Hi, everybody. This is Steve Sabludowsky, publisher at BayouBuzz.com. And today we're going to be talking Affordable Care Act, Obamacare. And we have Dr. Elaina George with us today. And she has, I believe, a lot to say about the Affordable or the Unaffordable Care Act. I've looked at some of the information that was sent to me, and I just can't wait to be asking questions about this legislation, or now this law. So, hi, how are you doing today?
I'm fine. It's a pleasure to be with you.
Well, thank you so much. So, we're going to be putting this on not just my site, Bayou Buzz, but Facebook and YouTube, etc. So, why don't you give us some background information? I see that you are a medical doctor. You went to Princeton, and so please go ahead and tell us how you got involved with discussing the Affordable Care Act.
Sure. As you said, I'm a medical doctor. I'm actually in private practice, an independent doctor, and I originally trained in New York at Mount Sinai School of Medicine and Manhattan Eye, Ear, and Throat Hospital before I moved to Georgia and opened my private practice in Atlanta. So I've been in private practice solo for the past 16 years and on the front line of all of the healthcare changes that have come down the pipe from the time I opened my practice. When I initially came out in '98, it was the beginning of capitation, which I think people remember as the HMO plans, where you had to go through your primary care doctor and be referred. I'm an ear, nose, and throat doctor, so I'm a specialist, actually. And I remember one thing about that time period is that patients were very unhappy because they weren't able to access health care the way they wanted to. And it died on the vine and no longer to be resurrected by Obamacare and the Affordable Care Act, which is another revisit of the same capitated HMO plans, but now with the power of the government behind them. So we're seeing a movement backwards to where the patient and the doctor are on the outside looking in, and the insurance companies are running the system, and they're managing to do a bang-up job of denying care by costing the patients more, by shifting the cost to the patients, and kicking doctors off of their panels. So patients are finding it harder to see doctors. They're paying more for the privilege, and they're supposed to be happy with this system. And I think now that open enrollment season is finally rolled around and the costs have gone up through the roof, people are now finally paying attention.
Okay. So do you find that it's the cost, the premiums, the deductibles, the access or lack of access that's really the problem?
It's all of the above.
Okay.
We're seeing a consolidation of the healthcare system and a corporatization of it from private practice. In '98, now about 80% of doctors went out into private practice or small groups. Now we're down to 20% of the delivery system, and we're seeing a movement away from doctors towards mid-level providers such as nurse practitioners and physician assistants, and it's not by accident. It's because they cost less. So now doctors are in the process of becoming administrators, just like the registered nurses are as well. And the people who know the most, who actually deliver care on the front line, are now on the back burner. And all they're doing is signing off on charts. I don't think most people are really looking for that kind of health care, because what it's done is it's become a conveyor belt mentality where it's one size fits all. And the way the Affordable Care Act is set up, it's all about accountable care organizations, evidence-based medicine, meaningful use. These are all cute little words just to really mean that the government and the insurance companies are running the show. So I cannot tell you how many times I'm seeing denials based on what the insurance company says is not medically necessary, experimental. It's completely arbitrary. And they are in the business of running every aspect of the healthcare dollar. The doctor, him or herself, only counts for 7 cents in the healthcare dollar. The rest of it is the administrative fees, the hospitals, the pharmaceutical industry, and the medical insurance industry. And unfortunately, those players were empowered under Obamacare.
Do you blame the government or do you blame the insurance companies, or both? I mean, one of them, I mean, they're partners in a sense, but...
Yeah, they are.
Yeah, go ahead, please.
It's a combination. I think that we were caused to believe that if you have health insurance, it equals access to quality health care. It conflated the two. And I can tell you as a doctor who sees a patient every day, that is not the case. The insurance companies are actually barriers now to access of health care. They're denying care. They're making people do pre-certifications. They're telling people and doctors it's okay to do it, and then after it's done, they're pulling the rug saying it wasn't medically necessary. So it's not a fair playing system. I don't think any doctor or patient, we just want to get each other, work with each other to get the patient better. And we have now a middleman that is on steroids that's designed to muck it up, basically. So they're becoming administrators of the healthcare system, but they have a conflict of interest. Remember, they're not in it to really help people. They're in it to make money. So they make money by having a patient pay a premium, having a doctor get less of a reimbursement, and when possible, shifting that cost to the patient in deductibles and coinsurance. And they've done a bang-up job of doing that. And what it's managed to do is cause people to self-ration. So patients themselves are denying themselves care. They don't come to the doctor in a timely way. They deny the medication. They skip a couple of doses. They don't do the surgery. So when they tell you that the healthcare costs have dropped, that's really the reason why they have, because the patients cannot afford to access the system. And I think the fact that people premiums have gone up to upwards of 60% is a travesty. And doubling down on that will not fix it. You can't tinker with that anymore. You need to scrap it and start over.
Okay, we'll talk about the scrapping and start over in a few seconds. It was my experience that insurance companies basically had been in the denial business for quite a long period of time. Certainly before Obamacare and pre-existing condition coverage, every opportunity insurance companies had to deny coverage, they would. And I'm just wondering, I mean, has that changed any? Has that improved? Has it decreased any or what?
Actually, that's not the case. I actually wrote a book about this called Big Medicine. And initially, the insurance companies that started out, Blue Cross was one of the first, and it was doctor run. It was a nonprofit, and it actually was not in the business of paying for every healthcare dollar from dollar one. It was designed for big ticket items, surgeries, lab tests, things like that. And the patient was actually responsible for their first, X number of dollars of care. So they didn't deny things. They just paid it when a bill was submitted. When they got into the business of the HMO and the capitation, that was different. They started paying for the first healthcare dollar. And when they took control of that, when they had that much of the actual business, that's when they started to ration it and change the behavior of people. People need to go back and do some research. And if they Google the Rand Corporation, they'd find out more about it.
But I mean, that's still about a decade or so prior to the passing of the Affordable Care Act. I'm talking about, from late 90s to the early 2000s. I mean, there was a tremendous, it seemed to me at least, there was a tremendous amount of pre-existing conditions that were being denied. As an attorney and having clients, I had quite a number of situations where, people were denied for various reasons. So
it hasn't changed, I have to tell you. They just do it in a different manner now. It's pre-certification, it's medically unnecessary, and it's experimental. So they still get the people, they still don't cover what they don't want to cover based on what the insurance company decides. So I can name any specialty out there who, from their medical specialty boards, can do a procedure, offer a service that is medically necessary, proven to be appropriate, that the insurance company will artificially, because of their own guidelines, say it's experimental. I'm an ear, nose, and throat doctor. They've been denying allergy treatment, which has been present, allergy testing for years. It's now experimental. So it's completely arbitrary, and there's no oversight on this. So there's no level playing field. They get to be the judge, jury, and they get to decide what gets covered. That's a problem, and I also think that should be changed in a new healthcare paradigm. If it's medically necessary by the specialty board and by the, what's considered the standard of care, then insurance companies should not be able to decide arbitrarily. No.
Yeah, I mean that sounds good to me.
Me too.
Absolutely. But the problem is insurance companies are having problems making their, I mean, obviously, we know that some insurances companies have decided not to stay with the Obamacare system.
Mm-hmm. Well, let's talk about that.
Okay.
I don't have any sympathy for the insurance companies. The only thing they're complaining about is that their profit margin isn't as big as they thought it was going to be. They've had the ability to double dip during the Obamacare, at the advent of Obamacare. So they had the mandate going for them,
Mm-hmm.
but they also got paid for the government specifically if they felt that their roles were not, if they didn't have enough members on their roles. The government actually made them whole, so it gave them extra money. It's a system that's completely, it's skewed towards the benefit of the corporations. For example, as a hospital, if an indigent patient comes in, they don't have enough money to pay for the service, the government gives them money. But if an independent doctor owns a surgery center, they don't get to access that same money. As a matter of fact, they have to give free care, a certain percentage of free care, and the hospital system doesn't. So you can see the disparate, it's
Sure.
not exactly the same. Let's have a level playing field. Let's have, the free market work and have some competition. This is now a system that's based on monopolies. Some of the Obamacare plans are the only game in some states,
Mm-hmm.
which means if you don't buy them, you're out of luck. And I can tell you that they've jacked the prices up. They've denied care. Well, who's going to say no if that's the only thing you have to pick? That's a problem too.
So that's the insurance companies that would jack the prices up and deny care?
Absolutely. They've jacked the prices up. They've narrowed the physician roles, who's on their plans. They've narrowed or lowered the reimbursement to doctors, and they've jacked up the out-of-pocket costs to the patients. What kind of risk are they taking exactly? I'd like to know when that happens.
Okay. So if we go, and I love playing devil's advocate, so please forgive me. Okay. So if we go to a total free marketplace, we already have a history of their jacking the prices up.
No, you don't.
I'm sorry?
Now that's where, again, it's a misconception.
Okay.
The actual cost of healthcare, if you compare apples to apples, an independent surgery center, for example, and a hospital surgery center, the price is about 1/10 in the independent surgery center compared to the hospital. So, for example, if I take a patient for a tonsillectomy, I'm here in Atlanta, if I take them to an outpatient surgery center, freestanding, it's $2,500 for that tonsillectomy. That includes the surgery fee, the surgery center fee, the anesthesia fee. If I take that same patient to our general hospital here in Atlanta, it's $9,000 for the same procedure. That's the difference. So what patients are now paying for is administrative fees, non-transparent cost in the system. I can't tell you how many times I've called up a hospital and say, how much would it cost for a patient to get a surgery? They can't tell me until they do the surgery, and then they can tell you after the fact. Nobody should be in a system like that. When I can tell you, you can go to websites now, Surgery Center of Oklahoma, perfect example. Look at the entire price list of everything they offer and know exactly what you're going to be spending before you go to that surgery center. And in that state, that surgery center has had so much of an effect that the hospitals are now meeting their price. So they've dropped the price of their healthcare delivery in order to keep business.
Okay.
That's how free market works.
Okay. So of the entire Obamacare program, I mean, there are a lot of people now have insurance, more than they had before.
Mm-hmm.
I mean, that's a plus, am I correct? But there's a downside.
I would challenge that. You can carry health care. I challenge that.
Okay.
You can carry a health insurance card, but if you can't afford to use it, what's the point? Okay, so it's about affordable health care, not about just saying I have insurance, but being priced out doesn't help anybody. So we've seen after the Affordable Care Act passed, more people have continued to go to the emergency room to get care instead of going to a private doctor or to a clinic because their out-of-pocket costs are so high. So they've actually not been using it the way people expected, which was to go to their doctor, begin a relationship with a primary care doctor and be seen. They can't afford it, or the lines are endless, or somehow it's not really working. I think that, I think if you want Obamacare, if you want the government to help you, then you should have what you want. This is not about stopping that, but it's about putting pressure on that system for those people who don't want that to have alternate choice to choose because it benefits everybody. If a monopoly gets broken and they have to compete, if you have insurance, you're going to pay less. If you don't want to use that, you're going to pay less. That's the key.
Okay, let me throw this out to you. This is sort of a pet peeve of mine, and 2 years ago, over 2 years ago, I should say, I first realized, quite frankly, when everybody was talking about repeal, and replace, etc. I put my attorney hat on for a second. I was having conversations with some of my attorney friends in a forum like this, and I said, wait a second. If you repeal the law, that means the law is no longer in effect. And so I started thinking about it, having discussions with them, and I started writing about it, different columns and so on, and they're on my website right now, valuebuzz.com. So, my feeling is that, the current president-elect and many people in the Republican Party are saying to repeal and replace. Again, my feeling is, well, you can't do that, because if you do that, the insurance will drop. Now, certainly will drop with those people who are, using, say, Obamacare in terms of the channels. But, I think that any policy, and this is my position, any policy that provides a benefit that didn't provide before, okay, that is covered under Obamacare. And the insurance companies, once the law is terminated, they'll say, I'm sorry, but we're not covering you. Your thoughts?
Well, you always have Medicare and you have Medicaid. So this is not where someone's going to get dropped, just left out in the cold. And I think what President-elect Trump has said is he wants to keep the pre-existing. That's people like that part of the Obamacare policies. He's going to keep the ability for parents to keep their children on to age 26. The two most popular tenets of the law, sure, he's going to keep. The rest is free market forces. Now, again, let's get away from just numbers or just what perception of numbers are. A lot of people who were put on Affordable Care Act lost plans that they liked. So they got rid of catastrophic plans. They did not want to go on Obamacare, right? So they'd be happy to go back to a catastrophic plan. If they're young and healthy, they have no medical problems, they can be covered in that kind of plan. He also has health savings accounts. Right now, they are locked into the insurance companies. They are administered through them. That's a problem, because when they deny a service, you can't use your HSA to do what you want. I think they should be unhooked. So if you as an individual want to buy a health savings account, create one. That becomes a tax-exempt pot of money that you can use for you and your family. If you want to use an insurance model, you can. If you want to do direct primary care, which is growing by leaps and bounds, you can. You can pass it as wealth to your family members. See, I'm all about what works for the individual. Nothing works for everybody. If we shove everybody into one size fits all, there are going to be a lot of people that it doesn't work for, and they're being trapped in a system that doesn't work. Imagine making it smaller, more user-friendly for those who like it. There'll be less bureaucracy, better patient care, less wait times, and for those who don't, they can do what they like. But you don't have to pick one or the other. That's what I'm saying. It doesn't, you're not taking from somebody to have two systems running. I think to make everything work, the bureaucracy is too unwieldy. The doctors aren't in the system. 20% we're going to drop out of Obamacare this year after this next round, which means you're going to be in a clinic setting, waiting longer, and getting less access to care.
But you see, and I understand what you're saying. You mentioned Medicare and Medicaid. Yes, I mean, Medicare for those people over 65, Medicaid for those people who fall within a certain income, who are normally working people, and those people who are obviously disabled. But, once you end the law, and this is the thing that really concerns me, okay, because I'd like to see change. I really would. I think that, we gave it a try, and I think, personally, if we can start all over, it'd be great. But by starting all over, you end the policies that are now in existence. And if there's no plan to replace, then
these policies aren't good, though.
I'm sorry?
The policies aren't good. All right. Let's talk about the politics of healthcare, because that's what it's become. It's become a political football. Under the Affordable Care Act, the Medicaid, Medicare, CMS has created this entire bureaucracy, whereas the physician, I would be forced to treat my patients the way they tell me I should treat them. That means they're going to pick my antibiotics, how long it takes for my patients to get better. If I can readmit the patient, people don't know this side of it. For example, in Medicare, if a person has a medical condition, they get discharged from the hospital and get readmitted within 30 days, the hospital won't be paid for that. Well, that means that people are now under pressure to telemedicine, treat the patient as an outpatient, put him in hospice. Those things actually have a problem associated with them. It's not all sweetness and light. There's a lot of pressure in the system now to not treat people who are sick because it costs the accountable care organization too much money. The capitation model is about denial. And so even though you're covered, you better be within the ages of about 30 to about 52. Otherwise, you're starting to fall in the outliers where it may be less expensive to just give you palliative care or wait until you're blind before you get your glaucoma surgery. That's what people don't talk about. And that's what we're seeing on the front line as doctors. It's become a question as to whether you want to practice medicine using your Hippocratic Oath, or you want to be forced or coerced into a system where you get to decide winners and losers. I didn't take the Hippocratic Oath to do that. I love my patients. I want to give them every aspect of healthcare that we decide together that they need. And to have the pressure of the insurance companies and the government come down on us as physicians, it's sapped our will to be doctors. And I have to tell you, 400 doctors are committing suicide each year since the passage of Affordable Care Act. That says volumes about how much it's affected the healthcare profession from a doctor's standpoint. It's unacceptable. I'm an advocate for my patient. I don't have a fiduciary responsibility to a hospital. I have a moral responsibility to my patient. This system as it's set up now puts me at odds with both. I have to pick. And I've chosen not to be in that kind of system because I love what I do. But what about the next generation of doctors? People need to think about that.
I would still argue that, if the insurance were all of a sudden terminated, okay, that nobody would have coverage or very few people would have coverage, maybe employer-employee insurance, that type of situation. And I hear what you're saying, that you don't really have much as it is right now, but at least you have some. One last question, if I might, unless you disagree with what I'm saying. I
actually disagree because the free market healthcare system is thriving. There's direct primary care practices popping up all over. That's a membership model where you pay $60 a month. For a family, maybe $120 a month. That covers everything that goes on in that doctor's office. I have a version in my practice. And I'm ear, nose, and throat. 15 visits a year, covered for $90 a month. Everything I do, scopes, hearing tests, treatment. We even have a pharmacy, which you can actually roll into the cost. So you can do routine things that cost you a fraction of what it costs in the insurance side of it. So when you actually do need something that is catastrophic, you're covered. You've got AFLAC, supplemental policies, where if you get sick, you get a lump sum of money for $19, $20 a month. There are options out there that people never talk about that fit a lot of people. If you don't know it exists, you'll never know to ask for it. Medical cost sharing, things like Liberty Health Share, Samaritan, Medibid. I actually belong to Liberty Health Share. I'm paying $199 a month. I have a total out of pocket of $500 per calendar year, and I'm covered up to $1 million per occurrence per year for anything medically necessary. So I chose an alternate path that I don't worry about the Affordable Care Act because it's written into the law. So I'm within the letter of the law, but I have freedom to make my own decisions with my doctor.
Now so that law has a $1 million cap per year.
Per incident.
Per incident, okay.
Correct.
And per year?
That's right. Okay. So if I have a gallbladder problem, that's $1 million towards that. If I have another issue, it's $1 million towards that. Okay. So it covers you for catastrophic, but I'm responsible for the first $500 of my care. I think that's a reasonable alternative for me. But you need a gamut of choices for people. If they're totally dependent on the system, I think they should have what they need. If they want to be totally independent and then just cover if it's something crazy, then they should have that option too. But the Affordable Care Act took those choices away. That was the problem with it. Let the market run. People will find what works best for them, and I think everybody can coexist.
Okay. So one last question, please, and that is, the president-elect says that he wants to keep those two provisions. Big one, of course, I believe, is pre-existing conditions coverage. Do you have any opinion, based on your experience in your practice, how are we going to be able to pay for pre-existing conditions coverage if there's no mandate?
Well, you have a risk pool. So the government would help create the money for the risk pool to cover those patients. And I would think that they would have to be in something like Medicare or Medicaid for that population to be covered. It doesn't have to be the entire insurance market. You can actually let the government cover that. I think that would be a much better way to protect the cost for everybody else, because right now, the young people, there were not enough young people to cover that many. You know, it just was so skewed, it didn't work.
Sure. And they got insurance when they needed it, and that's the problem. I mean, that's a real problem with the system.
Mandates don't work, though, because, I mean, Mr. Gruber's idea was, well, let's make it, let's tax them more for not joining the system. Well, that just means people are just going to pay the tax just because they don't want someone to tell them what to do. Let's do this in a manner that our taxes as a whole go to a pot of folks who need it the most, and then let everybody find their own level. I mean, I think we're just in this mindset that only insurance is the only way to do it. There's other ways to do it.
Okay.
That's all. And they already exist. And people would be pleasantly surprised that they're not spending, deciding whether they're going to eat or get groceries and go to the doctor if they pay for it themselves. It's cheaper to access the healthcare system in our country if you pay out of pocket at this point than it is to use your insurance card. That's the untold truth. Sounds weird, but it's absolutely true.
Yeah, it certainly does sound weird for sure.
I know.
Yeah. Listen, thank you so much. I really do appreciate having this discussion with you. I'm going to check about the high-risk pool and get back with you. I read something yesterday, but I really can't articulate it now about it, not being the way to go. But I really can't say that they're right or wrong. I just don't know at this point in time. Really.
Well, I look forward to coming back, and I love what I do. I think it's all about us having an opinion and not demonizing each other.
Sure.
And everybody's idea counts, and maybe we'll hit upon something that fits, that everybody can agree on. But if we can't, as long as we're free to choose what works best for us, I think that's the best option. And people can read my book, Big Medicine: The Cost of Corporate Control, and how doctors and patients working together can rebuild a better system. Because I go through exactly how we got to this point. It didn't just happen 2 or 3 years ago. This has been in the process for about 20 years. And it's unfolded slowly until the Affordable Care Act kind of pieced it together. But there's a better way. And ultimately, it should work for doctors and patients. We're the ones that it should work for. And if we're not happy, then something has to change.
Sure. I definitely understand. I really do. Thank you so much. I really do appreciate it.
It's a pleasure being with you. Thank you so much.